The U.S. is now at 25 million cases of coronavirus. That's according to the COVID Tracking Project. Hospitalizations are falling nearly everywhere in the country, but COVID-related deaths remain at record levels. And Johnson County, Kansas is trying to improve its vaccination process. I'm Kelly Eckerman. On Tuesday, long lines in Shawnee caused dozens of elderly residents to wait outside in the cold. People also complained about tight quarters once they got inside. The confusion prompted an apology from the health department. KMBC 9's Kelly Gibbs is live now in Shawnee with an update.
Well, Kelly, the Johnson County Health Department ensuring today that nobody was left outside in the cold and that proper social distancing guidelines were followed inside as well. Now, this was the scene from earlier today. We are now at the Mid-America West Sports Complex in Shawnee. Some of the biggest changes included increased staff, warming buses and shuttles circling the lot to help with transportation, front door drop-offs, and strict adherence to social distancing guidelines inside, as well as coordination to encourage residents to stay in their cars until their appointment time. The health department making it clear today it was important to apologize for mistakes made on Tuesday and make these changes quickly.
It was very important to admit those errors and those gaps, but it's more important to let them know that we're ready to do this, we're prepared to do this, and that we're going to fix that and learn from those errors and be better prepared today. And that's what we did.
It went very smoothly, very quickly. The shot didn't hurt. Just a quickie.
And many people like Hope telling us that this was a very smooth and a very safe process out here today. More than 1,600 people were vaccinated here. Reporting live in Shawnee, Kelly Gibbs, KMBC 9 News.
This is phase 2 of the Kansas plan. People 80 and older can get vaccinated. It's also for people in these industries: education, food, agriculture, childcare, and emergency responders. There may be a move to start getting vaccines to your local pharmacy. KMBC 9's Michael Mahoney reports it could be a way to address the distribution problems.
The hope is involving local pharmacies could help improve the low rates of vaccination in Missouri, which is last among the states, and Kansas, which is near the bottom.
We have the opportunity to increase the availability of the vaccine to a lot more people by determining how we can engage more pharmacists and pharmacies.
Moran was on the KU Health System news briefing Wednesday morning. The McClatchy News Service is reporting the Biden administration is thinking about sending vaccines straight to pharmacies, maybe as early as next month. Many people are more familiar with going to a pharmacy versus a public health department. And in some small places, the pharmacist may be all they have.
We have folks that deal with their patients on a daily, if not weekly basis at least. They know their communities, they know their patients. They're a trusted resource out there.
But it seems to me there's an opportunity for the local community pharmacist, again, particularly in rural places where there may not be a Walgreens.
In Missouri, many long-term care residents and their workers have now been vaccinated, and the Biden plan may shift some of the CVS and Walgreens vaccine used for the care centers to the local pharmacies. There's growing frustration about the vaccine supply, who can get it, where they can get it, and when they can get it. Michael Mahoney, KMBC 9 News.
A new survey from the Kaiser Family Foundation shows that most Americans are in the dark about their vaccine status. 60% say they don't know when people like themselves will get vaccinated. 55% don't know where they will get a vaccine. We want to help answer your vaccine-related questions, so we've posted county-specific information on vaccines from local health officials. It's all at kmbc.com/vaccine.